Dear Aunt Flo, I hope this letter finds you well. I wanted to share with you a deeply worrisome story that has come to light about your nurse niece named Lucy Letby, whose actions have left a lasting impact on the medical field. Lucy Letby was born on January 4th, 1990, in Hereford, England. From a young age, she exhibited a kind and caring nature, which led her to pursue a career in nursing. She graduated from the University of Chester with a nursing degree in 2011 and began working at the Countess of Chester Hospital shortly thereafter. Colleagues and friends described her as a dedicated and compassionate nurse, someone who was always willing to go the extra mile for her patients. She was the picture of kindness, a dedicated nurse in the neonatal unit. Parents entrusted her with their most precious gifts, their newborn babies. A place meant for healing, for hope was breached. A betrayal of trust so profound it shook the very foundations of healthcare. Aunt Flo, the neonatal unit at the Countess of Chester Hospital, was a place of joy and anxiety. But between 2015 and 2016, a series of unexplained deaths and medical emergencies began occurring in the neonatal unit where Letby worked. Initially, these incidents were attributed to natural causes or complications common in premature infants. But as the number of cases grew, hospital administrators and medical staff started to suspect foul play. Parents, filled with hope and fear, watched over their tiny infants, but a shadow fell over the ward. An internal investigation was launched, revealing a disturbing pattern. Lucy Letby was present during each of these incidents. Babies who were stable suddenly deteriorated and, in many cases, died under mysterious circumstances. Further scrutiny of medical records and CCTV footage provided compelling evidence that Letby was deliberately harming the infants under her care. Her colleagues admired her, describing her as caring and competent. She was, by all outward appearances, a model nurse. How could this be, they thought? The babies, too fragile to speak, became victims in a twisted game. A game driven by a need for control, for power, for reasons that remain shrouded in darkness. In 2018, Letby was arrested and charged with the murder of 8 infants and the attempted murder of several others. The news of her arrest sent shockwaves through the community and the entire nation. People struggled to comprehend how a nurse, whose profession is rooted in care and compassion, could commit such heinous acts. During her trial, it was revealed that Letby had injected some of her victims with air, insulin, or other substances, causing their sudden and unexplained deaths. The motives behind her actions remain unclear, but psychologists have speculated that Letby may have derived a sense of power and control from these acts, or possibly sought attention and sympathy. The mother of one victim recounted hearing her baby scream and finding him with blood around his mouth while Letby was in the room. Letby claimed the blood was from a nasogastric tube, reassuring the mother by saying, "Trust me, I'm a nurse." The baby's condition rapidly deteriorated and he died a few hours later. On the day of the baby's funeral, Letby sent a sympathy card to the grieving parents. When she was arrested, investigators found that Letby had photographed the card before sending it and still kept the pictures. During the trial, it was revealed that Letby had to be repeatedly told not to enter a room where the parents of another victim were mourning. Letby had told a colleague that taking child A to the mortuary was the hardest thing she ever had to do. The Crown Prosecution Service highlighted texts Letby sent to friends, which they described as a live blogging of events and showing intrusive curiosity. About 2 hours after the collapse of Child M, Letby texted, "Work has been shit, but I have just won 135 on Grand National." Horse emoji. And unpacking party sounds good to me with my flavored vodka, ha. Letby also searched for the parents of several infant victims on Facebook, including on the anniversary of one baby's death, and had looked up information on 11 affected families in total. The prosecution argued that the suspicious incidents began in 2015 when Letby became qualified to work with infants in intensive care. In April 2016, when the ward manager moved Letby from night shifts to day shifts, the pattern of incidents shifted accordingly. Law professor Burkhard Schaefer later questioned the prosecution's use of statistics, pointing out errors, omissions, limited sample size, and unclear criteria for defining suspicious incidents. A consultant testified that in February 2016, he found Letby standing over a desaturating infant without intervening. When questioned, Letby claimed the infant had just started to decline. The infant survived the incident. All the babies involved had been expected to survive, making their deaths sudden and unexpected. Previously, most collapses in premature babies were either anticipated or medically explained. But this was not the case for the recent incidents involving Letby. Between March and June 2016, 3 more babies nearly died under Letby's care. Toward the end of June, Letby was involved in caring for triplets, and the deaths of 2 of them on consecutive days deeply shocked and distressed the staff, except for Letby. This pattern wasn't new, as twins had collapsed within 24 hours of each other under her care in August 2015. Hours after one twin's death, the other became critically ill. A later police investigation found that someone had deliberately poisoned this baby with insulin, evidence that went unnoticed for 2 years. The insulin was identified as exogenous because it lacked C-peptide, which would be present if it were naturally produced by the baby. Laboratory analysis also confirmed that Child L had been poisoned with insulin, and hours later, his twin, Child M, inexplicably collapsed under Letby's care, but survived after 30 minutes of resuscitation. It was believed that Letby had injected air into Child M's bloodstream. Despite not being scheduled for night shifts, Letby volunteered to care for Child L. During the trial, Letby accepted that some victims had been intentionally injected with insulin and did not dispute that someone must have administered it. A pediatrician testified that he and other clinicians had raised concerns about Letby, but hospital administration dismissed them, telling the doctors not to make a fuss. Another doctor testified that Letby commented an hour before one baby died. "He's not leaving here alive, is he?" Although consultants wanted Letby removed from duty after the triplet incident, their request was denied, and the next day, another baby nearly died under her care. Letby was the only staff member present during all 25 suspicious incidents. After she was removed from duty and the unit was downgraded to focus on lower-risk babies, no further suspicious incidents occurred. It was also discovered that Letby had falsified patient records, altering the times of babies' collapses to avoid being linked to the incidents. Criminal psychologist Dr. David Holmes noted that Letby's varied methods, such as insulin and air injections and overfeeding milk, were chosen because they would dissipate and be difficult to detect. During searches of Letby's and her parents' homes, as well as Letby's handbag. Police found numerous handwritten notes with phrases like, "Help. I'm sorry that you couldn't have a chance at life. I don't want to do this anymore. Not good enough. Why me? I haven't done anything wrong. We tried our best and it wasn't enough. I am evil. I did this. And I killed them on purpose because I'm not good enough to care for them." The defense argued that these notes were the anguished expressions of a young woman in fear and despair due to employment issues and a grievance procedure with the NHS Trust. The prosecution, however, contended that the notes showed Letby's frustration at being removed from the neonatal unit. Letby denied that the notes were a confession, stating they reflected her mental turmoil during the investigation. The Guardian described the notes as the closest the prosecution had to a confession, while the Telegraph highlighted a note in which Letby wrote, "I'll never marry or have children. I'll never know what it's like to have a family," suggesting that her fear of not having her own children might have motivated the killings. Additionally, Letby's diary was found to contain the initials of the deceased babies on the exact days they died. The trial concluded with Letby's conviction on multiple counts of murder and attempted murder. She was sentenced to life in prison with no possibility of parole. The families of the victims expressed their profound grief and anger, mourning the loss of their innocent children and the betrayal by someone they had trusted implicitly. Join us next time for more in the series of Killer Nurses.